Diabetes mellitus is a chronic metabolic disorder characterized by sustained elevated blood glucose, resulting from defects in insulin secretion, action, or both. Occurs because of autoimmune destruction of the pancreatic beta cells, leading to absolute insulin deficiency. Insulin is required for survival, usually present in childhood, adolescence, and young adults. Several factors may increase the risk of developing type 1 diabetes, including genetics. A family history of type 1 diabetes increases the risk. People with other autoimmune diseases like thyroid diseases and celiac disease may be at higher risk. Viral infections such as Coxsackie virus and enteroviruses may trigger the immune response that leads to type 1 diabetes. Type 1 diabetes is of higher prevalence in northern countries like Finland and Sweden. The symptoms of type 1 diabetes usually develop quickly, often over a few weeks, and include excessive thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, blurred vision, irritability or mood changes, fruity-smelling breath due to ketones, and slow-healing wounds. Diagnosis of type 1 diabetes is made based on symptoms and blood tests to measure glucose levels. Fasting blood sugar that is greater than or equal to 7.0 millimoles per liter. Random blood sugar that is greater than or equal to 11.1 millimoles per liter with symptoms. HbA1c test that is greater than or equal to 6.5%. Autoantibody tests to detect markers of autoimmune attack. C-peptide test to differentiate between type 1 and type 2 diabetes. Most people with type 1 diabetes should be treated with multiple daily injections of prandial and basal insulin or continuous subcutaneous insulin infusion. Types of insulin include ultra-short-acting insulin, of which examples are insulin lispro, insulin aspart, and insulin glulicine, usually taken before a meal to cover the blood glucose elevation from eating. It is used with longer-acting insulin. The onset is 12 to 30 minutes, and the peak is within half an hour to 3 hours. The duration of action is 3 to 5 hours. Short-acting includes regular insulin, usually taken about 30 minutes before a meal to cover blood glucose elevation from eating. Used with longer-acting insulin. The onset is within 30 minutes. The peak is within 2.5 hours to 5 hours. The duration of action is 4 to 24 hours. Intermediate acting includes insulin NPH. It covers the blood glucose elevations when rapid-acting insulins stop working, often combined with rapid or short-acting insulin and usually taken twice a day. The onset is within 1 to 2 hours. The peak within is 4 to 12 hours. The duration of action is 14 to 24 hours. Long-acting includes insulin glargine, ultra-lente insulin, and insulin ditamir, often combined when needed with rapid or short-acting insulin. Lowers blood glucose levels when rapid-acting insulins stop working, taken once or twice a day. The onset is within 3 to 4 hours. There is no defined peak. The duration of action is more than 24 hours. Ultra-long acting includes insulin degludec, available as combined with short-acting insulin. Lowers blood glucose levels when rapid-acting insulins stop working, taken once a day. The onset is within 30 to 90 minutes. There is no defined peak. The duration of action is more than 24 hours. There are several sites for insulin injection. It is injected into the subcutaneous layer for optimal absorption. Abdomen is the preferred site. It is the best site for fast and consistent absorption. It can also be injected into the outer back area of the upper arm, where there is fatty tissue. The front and outer sides of the thighs can also be injected. Upper outer quadrant of the buttocks is recommended for long-acting insulin as absorption is slow and steady. Without proper management, type 1 diabetes can lead to serious complications. Short-term complications include diabetic ketoacidosis, a life-threatening condition caused by insulin deficiency, and hypoglycemia, or low blood sugar due to excessive insulin. Long-term complications include neuropathy or nerve damage leading to numbness and pain, retinopathy or eye damage that can cause blindness, nephropathy that may lead to kidney failure, cardiovascular disease that increases risk of heart attack and stroke, foot ulcers and infections that can lead to amputation if severe. If you find this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.